For activity 1, with a goal to understand infection risks in oral surgery, what we did was go to PubMed and search oral surgery infection control. From there, we chose an article entitled Antibiotic Prophylaxis in Oral and Maxillofacial Surgery. According to the article, one of the problem is surgical site infection, which is a complication of the oral and maxillofacial procedure and often result to morbidity and mortality. So if you don't know what SSI is, it is a type of healthcare associated infection that occurs in the part of the body where a surgery took. So according to article, to manage them, the use of peri, and post-operative antibiotic prophylaxis is recommended to reduce incidence. So overall, we have learned that there are many risks during oral surgery, and strict steps or proper infection control should not only be followed during but also before and after the surgery to ensure safety and successful procedures.
Activity number 2 is about the PPE check and compare for oral surgery. Oral surgery is considered a high-risk procedure due to the creation of the aerosol-generating procedures and the potential for significant fluid and blood spatter. The required PPE level is high. We have respiratory protection, the N95 respirator, and number 2 is the face and eye protection, which is using of the full face shield, goggles, or the protective eyewear. Then we have the body protection, the gown that we use, or the surgical gown. Number 4 is the hand protection, sterile surgical gloves. Number 5 is head or hair protection, or the surgical cap. And number 6 is the foot protection, or the disposable shoe covers. The PPE item I would like to highlight is the fluid-resistant surgical gown. Why is it important? Because gloves and masks protect the hands and respiratory tract, but the gown protects the arms, torso, and personal clothing from potentially infectious blood, saliva, and aerosol debris that are generated during oral surgery. Preventing cross-contamination. If the dental professional scrub uniform becomes contaminated, failing to use a gown could allow pathogens to be carried out of the operatory and potentially infect other patients or areas of the clinic. The gown acts as a critical outer layer that is properly removed and discarded or doffed inside the operatory.
Okay, for activity 3, sterilization flowchart with a goal to understand instrument sterilization steps, we have here a flowchart showcasing the steps on how to properly clean your instruments. This is from the article Dental Instrument Sterilization, a 6-step process by C.N. Palnick. This is from the PubMD website. So as you can see here, we have 6 steps. First is the pre-soaking and initial cleaning. Second, thorough cleaning of instruments. Third, packaging of cleaned instruments. Fourth, heat sterilization. 5, sterilization monitoring. And lastly, storage and distribution. The step that we decided to tackle on is step number 3. So you may ask, why is packaging before heat sterilization? This is because cleaner instruments must be packed prior to heat sterilization to protect them from recontamination after sterilization and before use. So we have here, it protects the instruments from recontamination, since in heat sterilization it might be somehow put together with other stuff. So with this activity, we have learned that it is very important to follow strict protocol and follow the steps to ensure that you're not only using usable materials but also clean, and for your patient to not be infected with infections or bacteria from dirty instruments.
Activity number 4, explaining to a child infection control. Action. Hi, I will be wearing my mask and gloves to keep germs away so we all stay healthy. These tools are very clean, just like washing hands before eating. You can keep You can help by opening wide and staying still. Together, we'll keep your teeth shiny and safe.
For activity 5, here is a quick checklist of 5 high-touch surfaces or items in the pediatric dental clinic that require disinfection. First one is dental chair controls or buttons. These are constantly touched to adjust the chair's position. Second is the light handles or curing light tip. The light tip is adjusted right before looking in the child's mouth, and the curing light tip often gets saliva or blood spatter. Third one is hoses and hand pieces. The hand pieces or gels and their connecting hoses are handled during the procedure and are aerosol contaminated. Fourth is countertops and or work surfaces. All areas where instruments and materials are placed must be wiped down. And lastly, the dent chains or clips. These are in close proximity to the patient's mouth and are frequently touched by the assistant while managing the dental bill. So those are the 5 high-touch surface items in the pediatric dental clinic that require disinfection.
A surface in the pediatric clinic that is often forgotten but is a significant root of cross-contamination is the computer mouse and keyboard in the operatory. Staff often enter notes or retrieve patients' records while wearing gloves that have been contaminated during the procedure. So, since the computer is not directly involved in the dental procedure, it can be overlooked during the standard disinfection routine.
Activity 6, which is the behavior management and infection control. Its goal is to connect child behavior management with infection control. And then you gotta choose one technique. Either the tell, show, do, or the distraction. And then so I choose, if I were to do this, I will choose the tell, show, do technique or the TST. First, it is the clinician first tells the child that what will happen in simple and age-appropriate language, a language that a child could understand better. Then shows using the tools, models, and mirror. You gotta show the child what do you use, what instrument do you use, either the suction tip or demonstration on a model for the child to picture out what will actually gonna happen. Then does the actual procedure. This helps the children understand what to expect. It reduces their fear, anxiety, and improves their cooperation. And TSD is among the most accepted basic behavior management techniques in pediatric dentistry and is widely used for children around 3 to 10 years old. Okay, and how does the tell, show, do technique help prevent germs from spreading, or how it helps in infection control? When kids feel calm and understand what will happen, they don't move suddenly or get scared. This helps with the infection control because, first, less sudden movement or fewer accidents. If kids don't jump, pull away, or close their mouth suddenly, it is easier for the dentist to do the work. This means few chances of saliva or germs to splash into tools or surfaces. Number 2, kids cooperate more with the germ control steps. When kids know what the things are for, they are more willing to do. And 3, our third one, the dentist finishes faster and smoother because when the child is calm, the whole appointment goes smoothly and ends faster. Less time or fewer chances for the germs to spread.
Activity number 7, orthodontic appliances hard to clean areas. We found that distal end cutter pliers and band removing pliers are tough to clean because of their hinges. If they aren't totally cleaned, sterilization fails. The best way to fix this is to use an ultrasonic cleaner first to blast the hidden gunk out of those tricky spots.
Activity 8, or the aerosol reduction in orthodontics. There are 3 orthodontic procedures that create aerosols. This produces spray, tiny water droplets into the air. First is the bracket removal using a high-speed handpiece. When the dentist grinds off the leftover glue after the taking braces on. And then, the tooth cleaning before putting the braces. It uses a polishing cup or a brush that spins fast. And then, the interproximal reduction, or smoothing or thinning the sides of teeth with a small rotating strip or rubber. And And then a one aerosol reduction strategy is the use of high volume evacuator or HVE suction. This is the big vacuum straw that dentist uses. It sucks up most of the water, the dust, and germs before they float into the thin air. And why does it work? It works because it catches droplets immediately. It keeps the air cleaner, and it protects both the patient and the dental team. And PubMed studies says that HVA suction can remove up to 90% of aerosols during dental procedures.
A surface in the pediatric clinic that is often forgotten but is a significant root of cross-contamination is the computer mouse and keyboard in the operatory. Staff often enter notes or retrieve patients' records while wearing gloves that have been contaminated during the procedure. So, since the computer is not directly involved in the dental procedure, it can be overlooked during the standard disinfection routine.